Shoulder injuries are one of the most common types of injuries that lead people to seeking out orthopedic care. Now, the shoulder is a highly mobile joint, allowing us to do a variety of different things, getting into different positions through a large range of motion. Because of this inherent mobility that we have, unfortunately, it's not the most stable joint. So it lends itself to being more easily injured than another type of joint similar in structure, such as the hip. The hip and shoulder are both ball and socket joints. However, the shoulder joint is a much more shallow socket. So when we look at the anatomy of the shoulder, we need to get familiar with all the different parts and pieces, and we'll start with the bones. And when we talk about the shoulder joint, we often refer to the glenohumeral joint. The glenoid is the socket part of the joint, and that is part of the scapula, or the shoulder blade. The humerus is the arm bone, and that is what makes up the ball of the ball and socket. Now, these two bones fit together and they articulate very well, but they don't have a lot of depth to them, making it a more unstable joint. So we have another structure, and it's a piece of cartilage called the labrum. This wraps around the rim of the glenoid, and it provides more depth and more stability to the joint. Outside of the bones and the cartilage, we also have a variety of ligaments that surround the joint, and these provide more structure. Ligaments connect bone to bone, so they are designed with a lot of stability in mind. Lastly, we have a variety of muscles that surround the shoulder joint itself. 4 different muscles form the rotator cuff, and the rotator cuff muscles share a common tendon that encapsulates the glenohumeral joint. These 4 muscles are the supraspinatus, the infraspinatus, the teres minor, and subscapularis. They play a large role in obviously rotating the shoulder through internal and external rotation, but they also provide a large compressive force, almost acting like a suction cup for the glenohumeral joint, and this helps keep the humerus in the socket, so it helps reduce the likelihood of a dislocation occurring. In addition to the rotator cuff, other muscles that you will find in this general area are the deltoid, the pectoralis major, the trapezius, notably the upper trapezius, our latissimus dorsi, or our lats, our rhomboids, and then there are a variety of other smaller muscles that attach to the scapula and help keep our scapula close to our rib cage. This articulation between the scapula and the rib cage is called the scapulothoracic joint. This joint is what allows the shoulder blade to move up and down. The shoulder blade can elevate, it can depress, it can retract and protract, and it can also have an upward or a downward rotation to it. When we think about shoulder motion, a lot of the motion does come from the glenohumeral joint or the ball and socket, but it also comes from the shoulder blade moving fluidly and smoothly on the rib cage. In addition to the glenohumeral and scapulothoracic joint, we also have our sternoclavicular and acromioclavicular joints, and this is where our clavicle or our collarbone comes in contact with our sternum and with the top part of our shoulder blade or our scapula. So when we look at the shoulder, think of it more as a shoulder complex with a variety of joints, and don't get too tunnel vision just on the glenohumeral joint. In a separate video, we talked about rotator cuff tears being a common injury that we deal with at the shoulder. Another very common injury that we deal with are labrum tears. Labrum is the cartilage that helps provide depth and stability to the glenohumeral joint. So it is often stressed when we have an incident of instability in the shoulder, commonly with subluxations and dislocations. Those are often due from high contact and impact activities, or having a large tractional or distraction force where the arm is being pulled away from the body. Other ways that a labrum can get injured are less traumatic, and it can happen through chronic wear and tear and a degenerative process from repetitive stress and strain, often found with repetitive motions or activities. Because the labrum adds stability and depth to the joint, it's often stressed when we are in extreme or end range positions. So if you are commonly doing a task that puts you in an awkward or extreme position, you may be agitating or putting stress on that labrum. And if you do it too much, too quickly, too forcefully, or simply too often, it may cause that labrum to wear down and eventually tear. For individuals dealing with a labrum tear, symptom profile may vary from person to person, but there are some things that are typically present in most cases. Oftentimes, it is common to have pain, and it is common to have instability or a feeling of instability when you get into different positions. Clicking or catching may also be present, and oftentimes we will have a lack of range of motion or a lack of strength, either because we cannot physically get into the position or because we are fearful and avoidant of getting into those positions. If you're experiencing any of these symptoms, make sure you reach out to a healthcare provider, and they can do a variety of different clinical testing and imaging to figure out if the pain, symptoms, and limitations you have are coming from a labrum tear or another complicating orthopedic issue within the joint, or from something unrelated to the shoulder at all. When we look at labrum tears, whether we're treating them conservatively or post-operatively, there's a variety of things that'll be done from a rehab standpoint with regards to regaining range of motion and regaining strength and stability. Some of these exercises will look very similar to other injuries and other surgical procedures. Oftentimes, there's a lot of overlap with what is beneficial for both rotator cuff injuries and labrum injuries. In today's video, we're gonna highlight different mobility drills that you will do, and also different stability and weight-bearing progressions that you may encounter with labrum rehab. Now, keep in mind, this is not everything that you'll be exposed to as part of your physical therapy routine or instructed as part of a home exercise routine, but these are exercises that we commonly utilize at Rehab to perform. As we're going through the exercises, keep in mind that your actual injury and whether you're treating it conservatively or if you are a post-operative patient is going to influence if these are appropriate for you to do, and more importantly, if they are appropriate, when they are most appropriate to do. Another thing to consider with this is that this is talking about injuries that are specific to the labrum and don't have any other complicating variables. If you have a labrum injury, but you also have a biceps or a pec or a rotator cuff injury, or maybe you had some degree of bony involvement, whether or not you're encountering these exercises or in what manner you may be modifying them could be specific to your case. But let's head out into the gym, and we're gonna cover a couple different mobility drills and some of my favorite weight-bearing and stability drills for shoulder labrum tears. When restoring mobility following a labrum tear, one thing that can help with a tolerance standpoint and an overall range of motion improvement is adding a level of distraction to the activity. And distraction means that we're just creating a little bit of space within that ball and socket joint, which for the shoulder, that happens through providing what they'll call long axis traction or pulling on the arm. These are a few of my favorite distraction exercises. The first one that we're gonna use at home, you can use something as simple as a sink. In the gym, finding anything that is going to be stable enough to support your body weight. In our facility, using a barbell in a squat rack is a great option. And we're gonna have the person positioned behind the barbell. Hands are gonna start right where the smooth and the textured part of the bar meet, and that's gonna put them roughly shoulder width. You can make them a little bit more narrow or a little bit more wide just based off of preference, but this tends to be a good starting point for the majority of individuals. From here, we're gonna go palms down to start, and they're gonna have feet about shoulder width, and then they're simply going to lean back. Tell them to touch their back pockets to the wall, bring their head in between their arms like they are going down to the ground, and then from this position, they can hold for a set period of time like a traditional stretch, or simply take 3 deep breaths in and out. Now, to take this stretch one step further, we can go in a palm up position. Doing this is going to externally rotate or position the shoulders, and it's going to give them a similar but just a little bit different of a stretch and a little bit different of a feel. They may end up feeling this a little bit more in their lats, through the side of the arm, and through the upper part of the trunk. Everything else stays the same, hands roughly shoulder width, Elbows stay straight, lean back, and bring the head forward. I like to begin with both hands on the bar. It makes them a little bit more stable, a little bit more balanced. It's a little bit friendlier of an introduction for somebody who may be a little bit hesitant or a little bit tentative, but you can progress that to a single arm version as well. And in this setup, the easiest thing to do is just to slide over to the column here. And if our right arm is the one that we're looking to stretch, we would put that out in front of us and then do the same thing. Just simply lean back, bring our back pockets to the wall, bring our head towards the ground. And now with this, you're gonna get all of that stretch on the one side. So it's gonna be a little bit more leverage, a little bit more intense. If you note the hand position, I have it facing in. We can put them in a more internally rotated position by flipping the palm on the other side. This position tends to be a little bit less natural. It's more towards their end range of what the shoulder joint can do. So it's going to be one that you want to make sure that they are comfortable with the hand in this position to start prior to attempting this one. When they go hand over, everything else stays the same. They're still going to sit back. They may feel that stretch just in a slightly different area of the shoulder. So we covered a few different mobility drills with the common theme of utilizing distraction in our mobility. Now we're going to shift gears and we're going to look a little bit more strength and stability oriented. And in strength and stability, there's a variety of different ways that you can achieve this and that you can train it. We're going to cover different weight-bearing options. And when we talk about weight bearing, and what some people may also reference as closed chain, or having their hand in contact with the ground, as opposed to moving freely through space, it's going to train not only the arm and the shoulder, but their entire trunk and core as well. With labrum injuries often happening with falls and with an individual trying to brace themselves on the ground, it's important to make this part of their rehab and reconditioning process. So we're going to go through a 3-step sequence of how we can progressively increase the demands of weight bearing and those closed chain activities. So with this, we're going to start off with a bear hold. We're going to be in an all fours position. So starting with our hands and our feet on the ground, and then from here, we're simply going to elevate the knees off of the ground. So we're going to elevate the knees and let them hover. As we do that, the individual will feel more of their weight shift over top of their hands. So they're going to have more weight bearing happening on their hands. With this, you can have the hold for as short or as long as what they're able to tolerate. For some individuals, it may be more of a repetitive up and down motion, where it looks like this, and they're simply doing a set of 5 to 10, where they're coming up and down at a cadence similar to any other weightlifting activity. 1 to 2 seconds up, 1 to 2 seconds down. You may have them want to work a little bit more on strength endurance and treat it more like a plank, where they're actually holding for an extended period of time. That's something that you have some flexibility with based off what your individual needs are, but the main purpose of this is we're introducing weight bearing to the arms, but we still have the safety net of both hands being on the ground, so it's more of a 50-50 effort with regards to the injured and the uninjured arm. So our next progression with weight-bearing activity, we're gonna have our feet further away from our hands. So we're gonna go from that condensed, crunched position of that all fours bear hold, and we're gonna go out into a high plank, or the up position of a push-up. Just as if you're getting into a push-up position, we have hands about shoulder width apart, we have our feet about shoulder width apart, or a little bit more narrow, and then we're simply holding. With this, we have more distance from our hands to our feet, so we have more weight that we're gonna control over a larger position. So it's a longer lever and a little bit more core stability demands with this. So the only thing that changes from the previous exercise to this one is our total body position. But let's say we want to make things a little bit more challenging. We want to add a little bit more stability demands. We can start playing around with having intermittent bouts of only one hand being on the ground. So with that injured arm, having a quick and brief moment where it is fully supporting our body weight. For this, same setup, but you can have the individual alternate touching the opposite hand. With this, it forces them to bear weight on that injured arm, but the net of that hand coming back down to the ground. Typically with this, we will dose it like any other exercise where you're giving them a set number of reps or touches to do. Somewhere between the range of 10 to 20 tends to be effective and appropriate for most individuals. You can have them speed up or slow down, and you can position their hands more narrow or wider to whatever their abilities are. This next exercise in the sequence, the biggest thing that we're going to change is the amount of time that we're weight bearing on one hand, but also the position of our hand in relation to our body. So we're going to allow our hand to get away from our body, which a lot of labrum tears are injured not only because of contact or impact with the hand hitting the ground, but also when the hand gets into a position outstretched away from our body and encounters some type of force or some type of stress. So with this last variation that we're going to do, we're going to start in that high plank that the individual would have already done in a previous session, and we're going to add a little bit of a twist and a little bit of a rotation. So for this, the individual is going to start in the high plank. They're going to reach up to the ceiling, come back down, and then switch to the other side. With this, they would alternate side to side. The goal is to get a straight line from hand to hand, have their chest point towards the wall, and then back down to the ground. Same thing on the other side, straight line from hand to hand, chest towards the wall, and then back down. With this, it's a little bit more challenging, so you may need to modify the amount of repetitions that you're doing. 10 total repetitions, 5 to each side, tends to be a really good spot for most people to progress to. You could shorten that rep range to 2 or even 3 on each side as a good starting point. Hopefully this video gave you a little bit of information regarding the shoulder joint, labrum injuries, and what some of the exercises may look like from regards to mobility, strength, and stability during your rehab process. If you found this video helpful, please like, share, subscribe, and stay tuned for our next video in the shoulder sequence where we highlight pec strains as our injury that we're going to rehab.